Thank you, Brad, and good afternoon, everyone. By way of update, as of 1 o'clock this afternoon, there are 319 confirmed cases of COVID-19 in Toronto, and this is up 39 from yesterday. There are 22 cases that are hospitalized, and approximately 16% are attributed to community spread. As I've advised you before, these numbers are constantly changing, but I will continue to update you on each day. I've also been notified of 3 new deaths amongst Toronto residents related to COVID-19. The first, an elderly man with pre-existing health conditions who was tested at North York General Hospital. And as well, 2 residents of Seven Oaks Long-Term Care Home. I offer my sincerest condolences to the family and friends of these individuals on their loss. This virus is spreading in our city, and this is why I continue to urge everyone to please stay home. When you don't stay home, you are putting our most vulnerable residents at risk. Our parents, our grandparents, people with compromised immune systems, and people with chronic health conditions. The effects of social distancing, of physical distancing, of keeping 6 feet apart from others as much as possible. The effects of these actions take time. So let me explain a little bit about how this works. First, you can be infected with COVID-19 and not know about it. For most people, it takes about 5 or 6 days before they show symptoms. For some people, it can take up to 14 days. Then there can be a number of days from the time you show symptoms to when you get tested and when you actually receive your test result. So what this means is that the positive test results that we're getting now are the result of infections that actually happened several days ago. So with that in mind, even if we all started staying home, started today, over the next several days, we would still see new infections from the past. But we would be preventing new ones from occurring. That's why it's so important to stay home now. We know from the experiences in other countries that social distancing, physical distancing, this works, but it does take time. Similar to any treatment that you've been given, you need the right medicine at the right dose for the right amount of time. I have observed that people are using parks to socialize and gather in groups. And I hear from a lot of Torontonians that there's a great deal of concern that this is contributing to the spread of the virus in our community. As you've likely heard, today I recommended that all amenities in local parks be closed. I've also recommended for condominiums, all Toronto schools, and the Toronto Community Housing Corporation to close their playgrounds and public amenities to limit congregation and reduce the spread of COVID-19. Again, I strongly urge everyone, please take your part seriously. Unlike other cities and countries, we still have the opportunity. There is still time to slow the virus spread, but our window is closing. We will get through this by working together. So please, stay home, stay safe, and take care of each other. With that, I'll now hand it over to Chief Pegg.
Thank you, Dr. De Villa, and good afternoon. As the head of Toronto's Office of Emergency Management, I'm in direct and regular contact with the Mayor, the City Manager, the Emergency Operations Center, and each of their respective teams, and of course with the Medical Officer of Health. We continue to receive expert, timely advice, guidance, and direction from Dr. De Villa and her team in response to the public health COVID-19 pandemic emergency. Today, Mayor John Tory announced that all amenities located within city-owned parks are being closed in an effort to enhance social distancing and to slow the spread of COVID-19. This is a difficult yet necessary decision that is being made in the best interest of public health and safety. The closure of these amenities is effective immediately. Over the next few days, signage will be placed at all of the city's more than 1,500 parks, amenities, and playgrounds across Toronto to ensure that the public is aware of these closures. Where fencing or gates exist, they will be locked. Unfenced playground structures will be signed and taped off. By way of summary, effective today, all amenities in city-owned parks are closed. City-owned playgrounds are closed. Picnic sites and park shelters are closed. Soccer, multi-use fields, and baseball diamonds are closed. Off-leash dog parks and trails are closed. Basketball courts are closed. Parking lots associated with city-owned parks are closed. Skate parks and BMX parks are closed. Frisbee golf locations and outdoor fitness equipment in city-owned parks are closed. Tennis and pickleball courts are closed, and city-owned outdoor allotment gardens and community gardens are closed. The advice of Toronto Public Health is clear. Physical distancing of at least 2 meters or 6 feet is critical in helping to slow the spread of COVID-19. Every one of us has a part to play in helping flatten the COVID-19 curve and to keep ourselves, our families, our friends, and each other healthy and safe. City staff continue to monitor compliance with the orders that have been issued in response to the COVID-19 pandemic emergency. While our preference is always to educate before we enforce, we have issued fines for non-compliance with orders, and we will continue to do so as required. The City of Toronto will enforce the closure of these amenities in accordance with the Toronto Municipal Code. Depending on the nature of the offense, the fines associated with accessing or using a city-owned facility or amenity can be as high as $5,000. Yesterday, Toronto Public Health attended 59 bars and restaurants. 4 warning letters were issued for premises found to be non-compliant with prohibitions on dine-in service. Additionally, City of Toronto Municipal Licensing and Standards staff investigated 38 complaints regarding locations that were open. Staff issued 2 notices for failure to comply with the orders made under the Emergency Management and Civil Protection Act. Both of these businesses were gyms. Staff are attending these properties again today in order to confirm compliance. In the event of continued non-compliance today, the City will engage Toronto Police to take the appropriate enforcement action. The City is urging all residents who are not performing essential or critical services to stay home whenever possible. By doing this, you are protecting those providing essential and critical services during these unprecedented times. There have been no changes to the essential and critical services that are provided by the City of Toronto, including emergency services, water, solid waste collection, shelters, respite sites, long-term care homes, roads, electricity, public transit, 311, and of course public health. Further, the City staff who are supporting and enabling the uninterrupted delivery of essential services continue to work diligently and effectively across all City divisions and agencies. I would like to again thank each and every person who is working to ensure that essential and critical services continue in Toronto. I encourage everyone to continue to make toronto.ca/COVID-19 their first point of access for credible information relating to COVID-19 and the associated city service adjustments and impacts. Each of us needs to do our part to follow the recommendations and direction being provided by our public health professionals. As Dr. De Villa again explained, we still have the opportunity to change the trajectory and outcome of COVID-19 in Toronto. Our success in flattening the curve depends on each one of us. I want to reassure everyone that we remain committed to leading our city through this pandemic. We are a strong and resilient city, and we will get through the COVID-19 pandemic emergency together. Thank you.
Okay, we'll start Mark McAllister with City News.
At what point does the enforcement get stepped up beyond just city staff to the police, and what would it take for that to happen?
Thanks, Mark. So there's an enforcement process that's in place. The complaints come in, as we've explained, into 311. They're received, they're forwarded and processed and reviewed within the Emergency Operations Center. That review includes review with Toronto Public Health and other city agencies, and the appropriate enforcement action is taken, which includes police. So very much an ongoing process. And like we've said, our first preference as a city is always always education ahead of enforcement. But we are actively enforcing. We will continue to actively enforce, and where we need the assistance of police in order to achieve that enforcement, it will happen.
And a follow-up, Dr. De Villa, if you would. We've been receiving tips from viewers about disposable face masks and gloves being littered across the city, the very PPE that everyone seems to be looking for at this point. What would the city do in order to minimize this at this point? What can be done?
So are we talking about discarding of unused materials, or?
At this point, it looks like it possibly could be used, but perhaps not. But the fact that they are being found throughout the city discarded, what would you say to that?
Well, I would simply ask that our residents, observe good behavior and appropriately dispose of whatever waste it is that they have, whether it's personal protective equipment or otherwise.
Thank you.
Okay, we'll go online now. Mark Douglas from 680 News.
Thanks, Brad. Dr. De Villa, I know that this is going to come up in social media after so many anecdotes about large gatherings in parks that have been going on for long since after the request for social distancing ever became popular. So the question then is, why close the parks today as opposed to a few days ago?
Well, thank you for the question. I think what we were trying to do was to create the balance and strike a balance between reducing virus spread and giving people the opportunity to make use of the great amenities that we have in our city. And, we know it's difficult to be told to stay at home and not have opportunities to get outside and enjoy some nature and fresh air. And the hope was that people would be able to do so in a manner that actually respected the request.
I'm not sure if the audio cut out there or Dr. De Villa, if that was the end of your comment.
Oh, sorry. Can you not hear me anymore?
Oh, the sound sort of cut out on my WebEx feed after you were talking about the need to be outdoors.
So I was speaking of the need to be outdoors and to give people the opportunity to enjoy some of the amenities in our city. And we were hoping that people in our city might be able to find an appropriate balance between enjoying those amenities and enjoying our parks, while at the same time respecting the request to remain 6 feet apart from all others. Unfortunately, it appears that that wasn't the case, that people weren't respecting that request. So we find ourselves in a position where we have to take this course of action in order to ensure that social distancing is maintained and to reduce virus spread.
Thank you. And follow-up question regarding these 3 fatalities. I think I'm correct. This is the highest one-day fatality count that we've heard. And should we expect more days in the weeks and months to come where we hear about multiple fatalities in the city of Toronto?
I think if we are to follow the trajectory of other cities and jurisdictions that are ahead of us in respect of their COVID-19 outbreaks, the answer simply is yes.
Okay, thank you, Mark. Matt Bingley from Global News.
Dr. De Villa, I'm just wondering, I've heard reports of an inmate testing positive at the South Detention Center. I'm just wondering if Toronto Public Health is helping there, and if you can elaborate further on just how containment would be used there.
Well, I think, we are actively engaged in all cases of COVID-19 in our city, and I can't speak to the specific details of the case. However, we do collaborate with our partners within the corrections system on issues, particularly infection prevention and control issues within that setting. And there are well worked out protocols for infection prevention and control. So when we run into a case situation and we're seeking to prevent outbreaks, there are protocols and standards that are put into place. Everything from enhanced surveillance and more monitoring to understand what's happening, checking with staff, enhanced cleaning, making sure that people are being appropriately isolated when they develop symptoms. These are the protocols that are followed in respect of infection prevention and control in congregate settings, including corrections.
Can you confirm if there was actually a positive test there, though, or a case, rather?
I can follow up with my team, so I don't want to make confirmations that I don't have solid data on.
Okay. Perhaps this is for the city manager. Just wondering, we've seen other jurisdictions such as Waterloo allowing people to exceed their garbage limits because they're obviously at home, they're expelling more, they're being told to throw out more. Here in Toronto, obviously you're told to keep it within your confines of your bin. Is there any consideration to allowing people to throw out more without having to have a tag?
That's something that I certainly will take up with our general manager of waste. I haven't heard it as an issue here in Toronto. We've had other measures put in place to kind of manage the volume that's coming. So leaf and yard, as you know, we've asked that we not have that put to the curb. So if there's an opportunity to support this community and measures like you're suggesting, I mean, we'd be open to considering that.
Okay, thank you. We'll go online now to Brian from the Toronto Sun. Brian, go ahead.
Good afternoon. Just sort of expanding on Mark's question there. As you're no doubt aware, Montreal has seen a troubling spike in cases, culminating in a dire situation that's developed in the ICU of Jewish General Hospital. With cases rising there from 94 to over 1,000 in just a few days. There's reports of their ICUs over capacity with critically ill patients, and other Montreal hospitals are taking up the slack. What's the current situation at Toronto hospitals? How many people do we have in intensive care, and what plans are in place in case there's an explosion of cases here, especially with people returning from March break?
So with respect to hospitalized cases, as I've advised you today, there are 22 cases in hospital, and there is a smaller fraction of those. If I remember correctly, it's less than 10 that are in ICU beds right now. I can't speak to the specifics around what's happening in Quebec, but it's worth looking at a variety of factors that can contribute to an increased number of cases. There may be issues around laboratory testing and the number of tests that they were able to do before and the number of tests they're able to do now. And that's just one example of a factor that might be changing how they're reporting and why the numbers might go up so suddenly.
Did you have a follow-up, Brian?
Nope, that's it. Thank you very much.
Okay, thank you. All right, back here to City Hall. Go ahead.
Hi, it's Chanel with CP24. Just wondering, Dr. De Villa, whether you at any point have considered recommending a lockdown for the city. Is this something that's on the table?
So I think what we need to do is find the ways by which we can affect core public health actions that we know make a difference. And we've had the ability to take a look at what has been done in other jurisdictions. So if we look at other jurisdictions, we know that elements like testing, and testing as many people as possible, is one core component of a public health response to an outbreak of COVID-19. We also know that case and contact investigation, and what I characterize as very rigorous case and contact investigation, is another method to help reduce the spread and to limit the impact, the negative impact of COVID-19. And finally, we've heard quite a bit around social distancing as one of the core public health measures out there. It's now a question of, how serious, how significantly do we need to move in that social distancing vein in order to achieve the goals. So not every jurisdiction has had to go to that. And it is our sincere hope that we're able to achieve our goals in order to limit the spread of COVID-19 by using less restrictive methods wherever possible. That is a public health approach. We try to use the least restrictive means available to us because we recognize that, yes, we are trying to control virus spread, but that needs to be balanced with the other impacts and consequences associated with those public health measures.
And Dr. De Villa, the science around this virus is evolving every day. In the beginning, we were told that only when you're presenting symptoms, you're contagious, or you're most contagious at that point. And now, of course, we know that you can certainly spread the virus without even knowing or being contagious or being presenting symptoms, that is. And so is there any science to show us whether once you do contract the virus and you perhaps test positive, does that mean you're immune to it?
So, it's an interesting, you're right, quite interesting virus situation that we're looking at here. This is a virus that was only discovered in early January and was never known to us prior to that. So we are all learning. And I would say that at the beginning, you're quite right. We talked a lot about symptomatic transmission, and I would say that that hasn't changed. People are more likely to transmit virus when they are symptomatic. When you're coughing or sneezing, you are generally more effective at transmitting whatever virus you may have. You're quite right that there is increasing evidence that you needn't be particularly symptomatic in order to spread the virus. However, I think it still is true that you are more effective at actually spreading that virus should you have symptoms like cough or sneeze. So I think we're continuing to learn, much to be learned yet around the virus. And I think you had one.
And on the question of immunity.
On the question of immunity, from what we can understand, again, still the studies are being done. I understand that there are some studies in China that have been done, and we are seeing that there are antibodies that people are developing after having had COVID-19 infection. What this means is that there is at least some measure of immunity. How long does it last? That actually has yet to be determined.
Right, that's what I'm wondering. Like, if you do test positive and you're quarantined for 14 days and then you go back into the real world and you're getting groceries or doing any kind of essential work, what does that mean? You could still pass it on to somebody.
No, it's not quite that simple. So if you're talking about somebody who's had an infection, we wait for them to resolve, and then they should be able to continue about their regular lives. If you're talking about somebody who's actually isolating because we're waiting to see if they develop the infection, as I mentioned earlier in my remarks, some people will take up to 14 days from the time that they actually were exposed to an infection until they develop signs and symptoms of the infection. But it is very unusual to go it's not that common. Most people will develop signs and symptoms within a 5 or 6 day period after having acquired the infection.
Okay, we'll go online now. Jennifer Pagliaro from the Toronto Star. Jen, go ahead.
Hi, Dr. De Villa. I wanted to ask about the deaths at Seven Oaks. Can you just help us understand what the situation is there? Are there others who have been tested? Are there staff that are in isolation? And how concerning is this situation for you?
Well, an outbreak within the context of a long-term care home is always concerning, whether we're talking about COVID-19 or any other infection. Unfortunately, these things do happen, and there are well-developed protocols and procedures in order to manage outbreak situations. So we know that there was, I reported earlier that there was a resident and a staff person who had COVID-19 infection within Seven Oaks long-term care home, and unfortunately, as I've just reported today, 2 residents of that long-term care home are now deceased. In terms of managing the situation there, as I said, we manage outbreaks in long-term care homes on a regular basis. That's one of the routine functions and core functions of public health. And there are very well worked out protocols and procedures in respect of managing outbreaks and engaging in infection prevention and control. Everything from implementing full precautions, contact and droplet precautions in the affected area, enhanced cleaning, enhanced surveillance and monitoring, both amongst residents and for staff. So for example, any staff person who's called in sick is actually being asked, what kinds of symptoms and signs might they be having, and they're also being encouraged and offered testing in order to understand whether in fact they might have COVID-19 infection themselves. Room isolation, and of course communications with families. These are all part and parcel of what is done within the context of an infectious disease in long-term care.
And can you provide some context for the updated numbers? You mentioned 16% is related to community spread. I wonder if that number is increasing, how concerning that is, and whether there's anything you can say about the number of people that are recovered and perhaps whether that is not as many as you might have hoped.
So with respect to community spread, as we've been saying all along, we had anticipated that this would happen. So I do expect that number to increase. We are continuing to see travel-related cases, but we should expect to see community transmission, so this number doesn't surprise me. I think we are going to continue to see constantly changing numbers in this regard, and we'll make every effort to ensure that you're up to speed with respect to what's happening in our community.
Okay, thank you. Dave Ryder from the Toronto Star, please.
Hi, Dr. De Villa. Can you tell me, not that many hours ago, Mayor Tory was tweeting out a photo of the new signs that were going to go into playgrounds saying stay 2 meters apart, and we haven't wiped down the equipment, and then we get a thing saying no, they're all closed. I just wonder, following on an earlier question, what was the trigger? Was there a picture or a video or a child being infected? What all of a sudden seems like it made the city change course and close the parks?
I don't think it was an all of a sudden decision. In fact, it was observing what was happening and seeing how our community was responding to our requests and our recommendations around social distancing, including social distancing in outdoor spaces. We were very much hoping that our community would be able to respect the 6-foot distance from others outside so that they could enjoy those spaces safely. But unfortunately, we were getting a number of calls and concerns from Toronto residents, and certainly I observed, and I know that many of us here around the city were observing ourselves, that there were violations, people who were simply not following the recommendation to remain 6 feet apart.
And as an adjunct to that, and not my second question, just should the city, if people are still jumping on things or doing things they're not, should there be I know in England there's a truck that drives around with a loudspeaker saying stay out of the parks? Do we have to go that route?
I'm hoping we don't have to go that route, and I admit I hadn't thought about the possibility of a truck with a loudspeaker.
My follow-up question
but I might let Janie know about that now.
My follow-up question for Chief Pegg. I know on the daily call that you guys have, I think it's the first one's at 6 a.m. and there might be another, that there's a tally given of EMS personnel for the city, of paramedics, firefighters, and police who are either in isolation or have actually COVID. Can you give us the latest numbers on that, and does it affect operational ability at all?
Sure, David. So two-part answer. So we roll, in order to protect, obviously, the confidentiality and privacy of all of our folks, including our residents and our staff, we roll that up into an aggregate. So I can tell you that things are relatively stable today. As it stands right now, 5% of our total staff in the essential service category are listed as being in self-isolation. And for the life of me, I forget the second half of your question.
I just said there's the daily call. How many, and does it affect operational?
Oh, sorry. No, it's not impacting the delivery of frontline service. The delivery of frontline essential service in Toronto continues to be robust and stable, and our residents continue to enjoy the same levels of certainly emergency service and other essential and critical services as they have in the past.
Okay, online, Nick Boisvert, CBC.
Hi, everyone. Curious to hear from Dr. De Villa and Chief Pegg on this. on the federal government's new mandatory self-isolation rules that are going to come into effect tonight. There's been some other municipalities around the country that have been taking, seems like, an active role in enforcing those self-isolation rules. What do you think, what kind of role do you think Toronto should play in making sure that people are following those?
You know, it's interesting. It would be, I've actually tried to encourage our residents to simply do the right thing in respect of protecting our community. I think at this stage of the game, it's difficult to know how do you enforce, how do you know whether there's a, you know, a violation or a recommendation that's not being followed. I think we have to judge each situation on its own merit. And take the individual circumstances into consideration. However, I would simply urge people to do the right thing, right? It's about taking care of ourselves, our families, our neighbors, our community. And it is, I realize, a departure from our regular behavior, but we are in rather unusual times. And these times call for us to take on these kinds of, you know, behaviors in order to protect our community and our families. So, you know, I would prefer, as Chief Pegg has said, our approach at the city has always been one of education first and enforcement only if required. And my request to our members of our community is to, you know, to simply abide by the recommendations and not put us in a situation where we have to move to more serious measures in order to protect the community.
Nick, did you have a follow-up?
Yeah, sure. The Minister Haidu also said today that if anyone lands here at Pearson and is showing symptoms, they're going to have to be quarantined here in Toronto, no matter if they're connecting to another city. That would go for any of the airports that are still open to international travel. Is that do you foresee that posing any kind of an issue if we have people who aren't from Toronto but are having to be quarantined here?
So I'm not certain of the details as to how that quarantine is to be implemented. So once I have some details on that, then I'll be able to comment more knowledgeably.
Okay, back online, Jennifer Pagliaro from the Star has a follow-up. Go ahead, Jen.
Hi, for Dr. De Villa again. I just wondered about healthcare workers at long-term care homes. We know that often they're doing temp roles or they may be traveling between long-term care facilities. Can you just speak to whether that's something you're considering changing or how that could impact other care homes?
Well, certainly within the context of outbreaks, we restrict the ability of long-term care workers to move from various settings or from different facilities in order to reduce the risk of infection spread. I do think that this is an issue that has been raised on several occasions, even outside of the context of COVID-19, and I think it's one of the many issues we will need to think about on in terms of the long-term future, how we best provide the necessary care, whether it's within acute care and long-term care, but how we do that in a manner that actually supports best infection prevention and control and resident health.
And can you give us any sense how many people from that care home, staff or residents, have been tested and how many presumed cases there might be?
I would have to check with my team on those specific details, but I can assure you that we are absolutely working in concert with the team at Seven Oaks, and we are implementing all the measures, everything from enhanced surveillance and enhanced monitoring, enhanced cleaning, implementing droplet and contact precautions, ensuring that the families are aware of what's happening, everything that is expected and that's required and that's meant to prevent the further spread of infection is being done.
Okay, thank you very much, everybody. That concludes today's briefing. We'll see you tomorrow.
Thank you.